A query from one of our young patient who is wanting breast implants, and this is specifically about breast implants in a patient having fibroadenomas. So this is a 24-year-old patient seeking a breast augmentation, but she wants to know whether she can actually address the lumps in her breast before she goes for the surgery. Now the answer to this is fibroadenomas, however small they may be, is best tackled before you actually go in for the breast implants. So some of these lumps may be very small, and depending on the location, they can be removed at the same time of the surgery. In cases where the size, the volume of the implant, of the swelling is much bigger, and these definitely will have to be removed because they may grow to much larger proportions. So it's best that these fibroadenomas are removed at the time of implant surgery or even before the implant surgery, so that the patient is much reassured. A query on breast reduction. A 43-year-old lady is wanting to know whether she can have a breast reduction since she's had this problem from a long time, since she was a teenager, and she's wanting to know whether these breasts are big enough for insurance cover. Now, in India, breast reduction surgery is still not yet covered by insurance unless the breast reduction is associated also by removing lumps and cysts in the breast. So if one has some amount of documentation where there is cysts or lumps, that probably can be covered under insurance, but otherwise it's considered to be a pure cosmetic concern, and India at the time being, it's still not covered under insurance, although in the West, in the US or maybe in other countries, it could be an insurance covered surgery. Another question on breast reduction. The patient is wanting to know whether she can achieve fullness in the superior breast area with a breast reduction with no internal bra, or will I bottom out again? Now the answer to this question is, by way of the design of the breast reduction surgery, a patient can have fullness in the upper pole. So using the patient's own tissue, the breast in the upper pole can be filled with the help of the flap, which is more bulkier, and that helps in having a fullness in the upper pole. Now there are a lot of patients who don't ask for it. In this case, the pedicle, the flap which we actually raise, is much thinner, and so the patients may actually end up with a very flat looking breast. But in patients who are wanting fullness, I tend to keep a little bit of bulk in the flap, and thereby helping our patients to achieve that fullness after breast reduction surgery. Another query on breast reduction surgery. Our patient is wanting to know whether removing 1,444 grams of tissue is too much. Now, when such patients who are wanting a massive reduction in the breast come to us, usually they have a very severe symptoms. They may have a very bad upper neck pain, they may have lower neck pain, the bra straps may be actually pinching into the shoulders, the cutting, fungal infections. So the severity of symptoms is quite bad. So these are the patients who have a massive breast enlargement. And normally such breast reductions are called major breast reductions, where the volume of the breast removed is more than 1,000 grams on each side. So 444 grams is a normal weight removal in a breast reduction surgery with patients with very enlarged breasts and severe symptoms.